Whenever you're ready.
So, the problem with the long stretched construct is, let's say, make it easy, two-dimensional. This is skin, then we have some fat, then we have fascia, then we have muscle, and then we have the bone. And obviously we put the tulips in the bone, or on top of the bone here. Let's make it easy, okay? Now, God bless the heart of the engineers. They think this is how we are going to operate, but anatomy get in their way. What that means, they think, you just bring something easy and so on. You just go under the fascia and just pass it through all of that. The problem is that in reality, let's say if there's only even two-dimensional. This is the skin, especially in thoracolumbar region. This is the fascia, and the bone is here. Let's say there is not even a curvature like that. And the screws are here. So let's say you have a perfect rod, a rod that looked like that. Maneuvering it underneath and then literally blindly passing it through all of that. By the time you're here, the rod wants to go, you remember the rod shape? The rod wants to go there. When you're trying to bring it up, skin is in your way. And then, if anything, now add direction to that is not coming out, it's going that way. Now, above of that, add that is not only not in one line, and in direction that it's not going this way, coming like this out. Now imagine there is a torsion or scoliosis. It is not 3-dimension that you have to think about. It's about 3-dimension and 6 degrees of freedom that in all direction, and even if the rod is shaped perfectly like what happened a few weeks ago, is passing it along all of that. It's just a matter of impossibility in a long stretch. And Dr. Mehra has noted that, I have noted that. Well, let's say now, again in 2 dimensions, skin, fascia, bone. This is just for visibility, okay. Let's say you have so much torsion, they are in so many different planes, that there is no way you can pass it all at once. Because of this, not only the double curvature, that we still can manage, but because of double scoliosis and torsion, especially double torsion, where vertebral body here turns this way, here turns that way. There is literally, it is just a physics. Making so many turns inside of the patient is just not possible. Now, with our system, we put a rod here. Because no, it's possible, because from one segment to another, or 3 segments, or even 4 segments, as long as you don't go over the double scoliosis or double torsion, all of that is possible. Now you put the rods here. Our system, where it has additional screw here, you put a second tulip and you pass a rod here. All of a sudden, or in another situation,